Hello, it's Mary Lou Novak with another episode of Resource for, the number 4, care.com. And Resource for Care interviews and speaks with healthcare and wellness professionals about navigating aging and providing care for loved ones. So it's really for your seniors and their adult children to gain some education and information that's really relevant to providing good care. Today we have Kristen Miller. Hi, Kristen.
Hi.
And she's with MidSouth, or she's the founder of MidSouth Aging Consultants. And today we wanted to talk a little bit about the skills for better care communication.
Right. So that's a pretty broad subject.
Yes.
And it can apply to anyone that is caring for an older adult or a person with dementia.
Mm-hmm.
And so particularly when a person has dementia, it can really challenge the way that you have to communicate.
Mm-hmm.
If you don't know, dementia just is an umbrella term that means problems with memory and thinking.
Okay.
And there's a lot of different diseases that cause that
symptom.
symptom.
Like you said, it's an umbrella of...
Right.
Yeah.
And so whatever the disease process that causes those problems with memory and thinking, the one thing that is going to be sort of a common factor is we have to now change the way we communicate to adapt to their needs. And the techniques that we're going to talk about that are applicable for dementia also work for other people that are just in the older age stage of life, or even people that maybe have special needs.
Mm-hmm.
Because when we talk about communication, we're talking about interpreting language. We're talking about interpreting emotions and body language, tone of voice.
Right.
But we're also involving executive functioning skills like decision making, thought processes, and
appropriateness
things like
in the moment, reading a room, reading a situation.
Sure.
Yeah. Okay.
So one of the best things that you can do to communicate, especially with a person who has memory problems, is to limit distractions.
Okay.
Because when you have dementia or you have some other type of neurological condition, it can make it really, really difficult for the brain to process multiple stimuli at the same time. So if you have noise and movement and TV and radio and multiple things going on, and you're trying to communicate, they probably haven't heard anything that you said, or their concentration is pulled in too many different directions.
That makes sense. Yeah.
So mute the TV or the radio. Move to a quieter area, and then start to express what it is that you need to communicate.
Okay.
It also helps if you get on that person's eye level.
Okay.
So that they can see your face. It also, because people with dementia tend to have a shorter attention span.
Yeah.
So they need that face time to really concentrate on what it is you're trying to say.
Okay. I mean, I found that with my dad when he had his brain bleed and he was really almost nonverbal, and he would get agitated, the less words when describing something. Is that one of the things on your list?
Absolutely.
Yeah.
Speaking more slowly and allowing more time for a response.
Okay.
Because especially when someone has dementia, our normal brain processing speed might be like this.
Yes.
Theirs is more like this.
Mm-hmm.
And so we have to slow down.
You're going to have to describe that because some people are going to be listening to this
and
not seeing your fingers go around in a circle.
So whereas,
so ours might be like this, right? And then theirs might be sort of a much slower cadence, Right. Yeah.
Yeah, so speaking, not only slowing down the way that you speak, but also only presenting one concept at a time.
Okay.
So, it's very common for us to maybe ask 2 questions in the same question.
My husband does that to me all the time.
Yeah.
He doesn't just ask a question, he'll give me 2 options. And I thought, well, that could have just been a yes or a no, but now I have to answer something.
Right. So
that's more complicated.
So one concept at a time.
Okay.
And then give them extra time to process what was said and then formulate a response. And if you've given them, a minute or so and they're not coming up with it, ask it again, because they may have lost their train of thought.
Right.
And if that doesn't work, rephrase the question.
So it doesn't work just to say it louder.
No. They're not deaf. They just need more time to process.
Right. Some people unconsciously do that, right?
Mm-hmm.
They didn't understand it the first time, so I'll just say it louder.
Well, and especially with people that don't speak English as a first language.
Right.
So this is also a technique that you can use for people that don't speak English as a first language.
Sure.
Because they're trying to pull from their memory banks the language that they've learned.
Yeah.
So just, give them extra time to process and then rephrase the question if you need it. This is a really big one. Because dementia can severely affect executive functioning and your ability to make decisions, limit their choices to two.
Okay.
Two concrete things. So rather than say, Mary Lou, what do you want for lunch? That's too many options. That's too many thought processes. But if I say, Mary Lou, would you like ham or turkey for lunch?
Right.
Now you have two things that you can work with, and you can make a choice. And that ability to make a choice and express your wants can also really reduce anxiety and agitation.
So it can make future or the next thing you communicate easier.
Right.
Okay.
One of the things that very much frustrates people that have special needs or dementia or some other condition is they feel like their control is being taken away.
Yeah.
And it causes a lot of agitation.
Sure. So they're already feeling agitated even before you ask them anything.
Right. So work with their brain.
Okay.
Give them choices they can make and give them control over that. Don't just hand them something out of the closet to put on. Say, would you rather wear this blue shirt or would you rather wear this white shirt?
So the more easy choices that they master, the more calm and more things are de-escalated.
Yeah, it really can help.
Okay. Never thought of that. That's awesome.
And then, of course, watching your body language and your tone of voice.
Sure.
Because even when a person has lost their ability to verbally communicate, they can still retain their ability to interpret body language.
Yes.
So if your tone of voice and your body language matches what it is you're trying to convey, the easier it is for them to understand and respond.
Right.
So things like, oh, it's a nice day. Why don't we go for a walk? And I point towards the door because the door leads outside.
Outside, right.
Or hand them a coat. It's a nice day. Why don't we go outside for a walk?
Okay.
So using those nonverbal skills can help a lot.
I did, I took a course at some point or education, and they said that sometimes demonstrating what you want them to do, like if you want them to take their shirt off because they're about to, shower or something or put a coat on, that sometimes miming the action that you're wanting helps reinforce the words, which the words might be hard, but then doing the two together might reinforce it. Do you find that to be true?
Absolutely.
Okay.
There's also a technique called it's parallel actions or parallel activities. So rather than telling somebody, oh, come over here and help me with these dishes, or go over here and look at these pictures.
Right.
You do it together, side by side.
Okay.
So that gives them a chance to mirror your actions, but also includes them in that activity, rather than you saying, go do this.
Right.
Now I'm doing it with you.
Yes.
Or
let's go over here. Or
let's brush our teeth together.
Right.
Let's comb our hair together.
Right. So for those that can't see you, you're actually pantomiming the action of brushing your teeth. So you're looking for that person who's communicating to, as they're saying it, move their hand up and down like they're brushing their teeth or combing their hair.
Right. And then actually
that's
go
that
in there.
Parallel thing you're talking about. Okay.
And then you brush your teeth and they brush their teeth at the same time. Now they're included.
Now we're the teeth brushing team.
We are. Another thing that can cause agitation in people that have lost their ability to verbally communicate is they might misinterpret your actions.
Okay.
So it is very important for you to explain what you're doing as
Right.
you're doing it,
Okay.
especially when it comes to a personal care task,
Mm-hmm.
such as buttoning a shirt
Right.
or toileting. And so rather than just jumping in and I'm going to reach across and put my hands in a very personal area
Okay.
without saying what I'm doing, I'm just
Right.
going to say, oh, I see you've missed a button. Is it okay if I help you
Right.
put this button together?
Right.
And so that way you don't have somebody going, oh, why are you in my personal
Right.
space? And
Right.
then putting up resistance,
Mhm.
which then a lot of times a caregiver might misinterpret as, oh, they're being willful
Yes.
or they're just being difficult.
Sure. Sure.
And they're really not.
I found the opposite to be true, like with my dad too, is that I felt like a lot of the caregivers were trained to, I'm about to do this, I'm about to do that, I'm about to do this, as a way to de-escalate a situation, but because of his brain bleeds, he wasn't, for all I know, he was hearing wah, 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 wah. So the more of that noise and the more of those words that he knew he wasn't getting made him more agitated. Can that be true also? Where
Yeah.
less words are better?
Yeah, it's definitely possible.
Right.
It's also good to use that communication technique in people that have blindness,
Mm-hmm.
because they obviously can't see what your
Sure.
intentions are,
Sure.
and you don't want to startle them.
Yeah, yeah.
Or if someone
I imagine if you can't see and then somebody starts unbuttoning
Right.
your blouse, like,
Right.
what?
Yeah.
Yeah.
Or touching your behind.
Yeah, exactly. We're going to go to the bathroom. Wait. What's going on here? Yeah, without saying anything.
Or if someone's in a wheelchair,
Mhm.
always ask their permission or let them know that you're fixing to move their chair.
Mm.
Fixing to, that's a very southern
It
thing.
is a very southern
Um,
thing.
And you're going to move their chair so that they're not just, why? I'm not in control of this movement.
Right. Interesting. Okay.
Also, this should go without saying, but I do feel the need to mention it,
Mm-hmm.
is to talk to that person, not about that person.
You would think that would be obvious, but you see it all, especially if there's a loved one in the room,
Yeah.
right? We see that a lot where they're talking to the caregiver instead of the person.
Especially at the doctor's office.
Mm.
So I always say adopt a mentality in your discussions, in your decision making
Sure.
that says nothing about me without me.
Mm-hmm. I like that.
Because they should be included. You know, I've heard so many times, oh, they don't know what's going on. Yeah, they do. They are much more aware than you might think.
Right.
And so they deserve
Yes.
to be included in those conversations
I agree.
and to not be patronized.
Right. Yeah, some of Teepa Snow's information too that I remember is that phrases we commonly use when talking to to others that maybe don't have a cognitive issue, like, oh, do you remember when we did this yesterday? For some people with dementia, that's code for you just forgot something.
Right. That's also something I cover a lot when I work with caregivers. I always say, don't use the words, don't you remember?
Right.
Because if they did, they wouldn't have memory issues, right?
Yeah.
So I always say, rephrase that question and say, Mary Lou, I don't know if you remember this, but I remember when we went to this luncheon and this is who was there and this is what happened.
Mm-hmm.
So now I'm giving you permission
Right.
to not remember it, but then as I'm telling you what we did and who was there, that might
Right.
jog your memory.
You could
pull
reminisce and
that.
maybe pull that from
Yes.
from their memory. Yeah, that makes sense.
Another thing that really gets under my skin is when I see family members that maybe a person hasn't seen in a while,
Right.
and then they go,
I
"Do you
knew that-
remember me?
I knew that you were.
Do you
What's
know
my
who
What's
I
my
am?
name?
What's my name?"
Who am I to you?
And if I was that person, I'd be like, "I don't have a dadgum clue,
Right.
who you are."
But apparently, I'm supposed to know.
right.
So now
Even
I feel
if I haven't
ashamed.
seen you in 2 or 3 years.
Correct. Now I'm ashamed. Well, even with advanced dementia, it could be, depending on where the synapses are firing, they might remember you one day, but not the next.
Right.
But they sure know they're supposed to know you
Right.
by the way you just delivered that.
And even people that they see every day,
Yeah.
you know, that recognition can come and go.
Yes.
So it's always a best practice to say, hey, Mary Lou, my name is Kristen, I'm your friend.
Right.
You know, just reintroduce yourself.
Yes, each time.
Yeah.
I agree.
One of the best pieces of advice I can always give to people
Mm-hmm.
is that every form of behavior, every behavior that you see is a form of communication. They may have lost the ability to express verbally what they need,
Right.
so they are telling you the only way they know how.
Mm-hmm.
And so that might look like resistance,
Yes.
and that might mean, I don't understand what it is you want me to do.
Right.
I really don't want to do this task.
Mm-hmm.
My shoulder hurts and I can't raise my arm and I can't do this task.
Right.
I'm
Or I've had enough
confused.
for the day
Yeah,
and
yeah.
I'm at my limit.
Right.
Yeah.
And so all of those behaviors
Right.
tell the story of what that person
Mm-hmm.
needs. And not only does that behavior, is it a form of communication, but it's also an emotion being expressed. And so that emotion may be, I'm confused, I'm scared,
Right.
I'm done,
Right.
I'm overwhelmed.
Right. And because it is an emotion, it should be, validated in some way and not just seen as adverse or
or they're just being difficult.
Mm.
Yeah, because I guarantee you 9 times out of 10 they are not trying to be difficult.
Right.
You are just not speaking the same language anymore.
That makes sense.
I always say behind every behavior is an emotion, and behind every emotion is an unmet need.
Mm.
So you just kind of have to peel back the layers
Right.
and say, what is the emotion that's driving this
Right.
behavior? If it's a rummaging through
Yes.
drawers kind
Right.
of behavior,
Right.
or repetitive questions,
Yes.
or getting things out, putting them back, getting things out, putting them back. It could be that the emotion is anxiety.
Yeah. Yeah.
I'm worried about where I put this thing,
Right.
or
Loss
I might
of
need
control
this.
and trying to figure out where things are, and by doing those repetitive things, self-soothing or some type of thing. In life coaching, because I'm a life coach, we say, treat everyone as if they're innocent every time you see them. A lot of times we carry with us the last experience we had with that person.
Right.
And it could have been at breakfast, where they were refusing to eat what we made, or getting dressed or whatever. And then if you hold on to that, then you're already, have escalated your feelings.
Right.
And it makes it harder for you to be open to these things that you're suggesting.
That is very, very true. So the best thing you can do for yourself as a caregiver is walk away.
Yes.
When you start to feel yourself getting agitated
Yes.
or worked up, walk away. Go check the mailbox, even if there's nothing in the mailbox.
Right.
Go in another room. Go hide in the bathroom and look at your cell phone or whatever it is you need to do.
Right.
And just give yourself time to come back down.
Yes.
And I guarantee you, if you're dealing with a person with memory loss, most of the time they will have already forgotten
Yes.
the last interaction.
Right,
So now you
right.
can start right back over again.
Yeah. And so, to give yourself permission to say that was then, this is now.
Yeah.
And de-escalate your own emotions.
Yeah.
Mm-hmm.
And finding ways to laugh, finding the humor in a situation.
Well, we do caregiving, and we find time. We all laugh.
Yeah.
And we're there every day. So.
Yeah, as long as it's not at their expense.
Of course, right.
But some things are just funny.
Yes. The happenstance of the human nature, right?
Yeah.
Things that happen.
Yeah. And then one thing that is especially important for people that do have memory loss is it is very common for them to go into the past or talk about something in the past as if it's happening right now.
Yes.
Don't argue.
Right.
That is their reality in
Yes.
that moment. We just go there with them. And it doesn't matter if they're talking about their husband that died 10 years ago,
Right.
as
and
if
they're
he's
expecting
right
to walk
here.
in the door any moment.
Yeah. Rather than say, well, he's dead.
Right.
Well, that's may likely start the grieving process
Absolutely,
again.
all over again, yeah.
Just ask them questions. Oh, well, tell me about him.
Right.
What does he
Let
do?
them reminisce.
Yeah, let them reminisce.
Mm-hmm.
And it may come back to them at some point
Yes.
that they're not here anymore.
Yeah. I had a friend recently, her mom was reminiscing a lot, and there were times where she would reminisce about some negative things that happened. Way before, I think even, when she was a child or something like that. And I just remember her mentioning that, I don't really want to hear those things. Like, can't we pick a topic, something that's more happy? But you can't really pick and choose, can you? You can deflect, right? Or there are ways to kind of elevate or make the conversation change.
Right. You can always kind of redirect.
Right.
Sometimes people get on a hamster wheel that they can't jump off of. And so during those times, it is good to maybe distract with something and then redirect their attention to something else. But on that point, she said, I don't really want to hear, these negative things.
Yes.
Are you always in control of the thoughts that pop into your head?
Yeah, right. Yeah.
Sometimes, just odd
we
moments.
might have enough restraint to not say them out loud, but we have to remember where they're at.
Right. Or, those times when we're alone and those memories come to the surface, we're not always in control of what things pop up at any given time.
Right, or how we get triggered by something and it brings the memory up.
Sure, and
it's true.
And lots of things can be triggers. Smells, sounds, music.
Yeah, or just a familiar feeling of anxiety or something.
Yeah.
You think again of when was the time I felt like this, and maybe it brings up a not so nice memory.
Right.
Mm-hmm.
And so during those times, if it is a not so nice memory, and maybe it brings up a lot of emotions, and maybe they're crying or they're scared or they're upset, just let them know that their feelings are valid.
Right.
Whatever they're feeling is very real to them. The same goes for hallucinations.
Yeah.
And let them know, it's okay, you're safe.
Right.
I'm not going to leave you. Give a hug or hold hands or whatever, let them get it out.
Right.
But don't just dismiss their feelings because it happened 30 or 40 years ago.
Or it's something you don't want to revisit. Right.
Yeah, we all know that one person that will tell the same stories 15,000 times,
Let me know if that's me, okay? Just somehow give me the high side. Yeah, I agree.
Yeah. So, those are just some really good things to remember about people that have problems communicating verbally.
Right.
So, just kind of recap, we want to limit distractions, get on the eye level, keep their attention, speak a little slower, allow for a response, and you may have to rephrase the question. One thing I have noticed, because I'm in and out of a lot of care facilities.
Sure.
We're in the South, and some of us have very thick accents. And a lot of the people that are living there are not originally from this area.
Yes.
And so they might be from the Northeast, like you. And so when we pronounce words a certain way, you can just see the confusion on their face, like, what?
I've been with friends, and they've said a phrase, and I'm like, all right, wait a second.
Like fixin' to?
Well, that one I've heard a lot, but every once in a while, there's a phrase or the way, like up north, it's tinnitus for ringing of the ears. Here it's tinnitus.
Yeah,
I wasn't sure it was the same thing, but it was just.
Or like pop.
Yes.
And Coke.
Right.
Or soda.
Yeah, when we first moved here, the list came home for the kids, and it said tennis shoes, and I'm like, are they going to be playing tennis? Why do they need tennis shoes? And for us, it's sneakers.
Right.
Right. Tennis shoes are specifically shoes to play tennis, but not here. That means sneakers.
Yeah.
So you're right. And there's some also accents that sometimes are different.
Right, especially if you have a person that is not originally from the U.S.
Yes.
and might have a foreign accent.
Sure.
those can be very hard, for people to interpret.
With dementia, yeah, because they have to think extra hard. When you were talking about speaking eye level, it reminded me of a client that I had who every morning, because of his dizziness, we greeted him in bed. So when we came, we were in bed. He was in bed, and he would get agitated, and we finally figured out he was like a CEO of his own company. But when we would come in, here we are, we're standing erect, he's laying down. So we're sort of like lording over him.
It's an intimidating posture.
It is an intimidating posture. So he wasn't really able, because he had dementia, he wasn't able to describe it to us, but we found out through trial and error that all the caregivers that would come in, we'd say to them, kneel by the bedside, get down to his eye level until he's up and moving for the day. Made a huge difference. He got up much happier than that. He's instead of starting his day cranky.
Right.
So, and you don't think of that because he's laying down. It's not as if you're intentionally doing it, but you're much more aggressive or assertive.
Well, even with people who are in wheelchairs.
Yes.
It's very tiring for the neck to have to look up all day. So
yes.
if you stand a couple feet back,
right.
that way they don't have to look all the way up.
Yes.
They can look towards you, or even just getting in a chair next to them so that you can be at the same level.
Yeah, be a pal, be a buddy instead of a caregiver talking down to them. Well, we talked a lot. We're almost out of time, so I've got to quickly just do my little commercial here for my sponsor. This podcast is sponsored by MidSouth Home Helpers, Tim Flessner, and they are the caregiving company with a heart. And you can reach them at 901-414-9696. So if you're in the Mid-South looking for a organization to come into your home or wherever you live and to help you with activities of daily life, I highly recommend Tim, and Janelle is his co-partner. They both were family caregivers for their family members, and now they're caring for other people, and they're doing a great job. We have just a minute or two, Kristen. If you could wave a magic wand or impart some wisdom, a nugget, to people caring for someone with dementia, what would that be?
I would always say to cherish the stage that they're in. And I know that sounds counterintuitive because why would you want to cherish a stage where they're
having to toilet with them or whatever,
wandering around and doing all these things?
Right.
That person is not a burden. They did not ask to get that disease. They did not plan to get that disease. If they had it their way, they would be doing all of the things that they had planned to do in this stage of life.
Absolutely.
Travel, be with grandkids, whatever. They did not ask for this situation, and they're not a burden. And your ability to provide care for them in that situation is a blessing. It's a blessing to them, and it's a blessing to you.
Right.
So never think of your caregiving as a burden. Are there some tasks that are burdensome? Yes.
Yes.
But it is a privilege to be able to care for someone else when they are in a position where they cannot care for themselves.
I can't tell you how many times when the care journey comes to an end and someone literally says, I wouldn't trade this time with my mom or my dad for anything.
Right.
And you don't realize it when you're going through the thick of it.
Right.
So I think that's really great advice. Well, thank you, Kristen. Thanks for coming in and sharing what you know.
Thanks for having me.
And we'll put in the video how to reach Kristen at MidSouth Aging Consultants, and she's available for consulting and evaluating different types of care, what fits people's needs.
Yeah, finding what are the next steps.
Excellent. Well, thank you. Thanks for coming in.
Thanks for having me.